Labour plans to introduce supervised toothbrushing for children at schools, as ministers are told that getting Taylor Swift concert tickets is harder than getting an NHS dental appointment. Joining me right now is Chair of the British Dental Association, Eddie Crouch. Good morning to you, Eddie.
Good morning, Julia.
I have to say, I am appalled by the idea that parents are sending their kids either to bed or to school without having cleaned their teeth. Seems to me it's parenting 101 to be doing this stuff. And if you're not doing it, you are doing your job wrong. But Labour basically saying far too many children have got dental decay, far too many children ending up in hospital. I think one of the main reasons children are in hospital now is to have teeth removed because they're so infected and decayed, and they haven't been able to see a dentist, and they are taken to a dentist and they haven't cleaned their teeth. Is the solution, though, for us to get basically, who are we kidding, teachers in primary school to be helping them brush their teeth?
Well, I think, the move to prevention is one that we would want to see. I mean, these children are suffering sleepless nights, multiple antibiotics. They're waiting months probably to go into hospital for a general anaesthetic. Anything we can do to prevent that is great. And in the areas of the country where this has been tried out, in Scotland and in Wales, we're seeing a significant reduction in the number of children needing to have teeth taken out. So we need to move to a preventative method. My colleagues want a contract that allows them to deliver more prevention. And £1 invested into a scheme like this delivers £3 to the NHS. So it makes financial sense.
It might make financial sense. I do get that. But I'm thinking, isn't the best prevention getting parents to do their job in the first place? I realise some parents aren't going to do it, but it seems to me, and we don't want children to suffer as a result of those hopeless, hapless, feckless, lazy, shouldn't be parents at all parents. And let's call it out like it is. If you're not getting it, if your kid doesn't have a toothbrush and toothpaste, and you're not getting your kid to brush their teeth, you're a bad parent. I'm sorry. I think we need to call this stuff out. But does it? Are we putting yet another job in the hands of teachers who are already toilet training some kids? They're having to feed kids. They're basically social workers now. We might be quite nice if we allowed teachers to do a bit of teaching occasionally.
Well, effectively, where these schemes have actually been introduced, they've been introduced at a time where it actually fits into the school curriculum. And these, we're talking about, preschool children in the main. We're talking about 3 to 6 year olds. And we're talking about an application of fluoride onto their teeth, which is actually going to help them. We could argue about whose responsibility this is, but this is a solution to help children who are suffering with tooth decay, and this is a method of actually improving that.
I mean, the scale of children going into hospital for needing a serious surgery, often under general anaesthetic, to have teeth removed is, I think, absolutely, frankly, horrific. But it is also a problem with dentistry generally. Taylor Swift tickets are easier to get than an NHS dental appointment, ministers have been told. People are carrying out Dickensian-style DIY dentistry. Lots of people are going private. But basically, I'm very lucky. I've got an NHS dentist. You have to move from an NHS dentist to an NHS dentist. You can't ever leave the system. You'll never get back in again. For many millions of people in this country, you cannot sign on with an NHS dentist. Why not? There are lots of dentists. My God, they're busy giving people Botox and teeth whitening. Why can't you get an NHS dental treatment for millions of people?
Well, absolutely. I totally agree. Why can't you? And the answer lies at Westminster. And there was a 3-hour debate about dentistry only on Tuesday. And what I heard from the minister, that things were improving. Well,
why is it the government's fault? Why you've got dentists who say, I'm not taking on any more NHS patients. Is that because they're not paid enough for them? What's the issue?
Well, yes, because the government haven't really made things better quickly enough to actually solve the problems that we've got. We've got 12 million people at the moment who probably want access to an NHS dentist in England alone. And yet the minister from the dispatch box the other day was quoting the improvements in access that has been there with their marginal changes that they've already brought in, as though that was a significant improvement.
But you can't walk down a high street without seeing loads of dental surgeries. And there are loads of people, you say 12 million people, who want to go and see an NHS dentist. What is the issue? Why are they not willing to take NHS patients?
Because the contract is unworkable.
How much do they get paid for an NHS patient? Does it cover their costs? How much do they get paid for an NHS patient? Does it cover their costs?
Well, there's a lot of treatment that NHS dentists are carrying out on a daily basis that becomes almost a charity. You would have been better off to have given the patient some money to go away and find the treatment elsewhere, because you will lose less money than that. No
Right.
business can operate on that system.
Okay, that's a fair point. Eddie Crouch, Chair of the British Dental Association, thank you for that.